Have you ever wondered what causes epilepsy? In this video, I will discuss in depth the causes of epilepsy, management, and control of epilepsy. If you're new on this channel, welcome. My name is Dr. Emeka. Please click on the subscribe button if you have not already done that. Turn on your bell notification so that anytime I drop new videos, you will be notified. Like and share this video. Please don't forget to subscribe. So let's go straight into the discussion about epilepsy, the causes and management of epilepsy. Epilepsy is a neurological condition that causes recurrent seizures in an individual. It is fairly a condition that affects 1 out of 100. In fact, there's a study in the United States that says approximately 3 million people live with this condition in the United States, and close to 50 million or between 50 to 70 million people across the globe live with this same condition. So you are not alone. Epilepsy is excessive firing of electrical activities in the brain, excessive neuronal activities firing in the brain. But the good thing is that the brain is strictly regulated by channels and receptors. And it also has two signals. You have the excitation signal and the spark electricity. Okay, that has a component of glutamate, which also has in it some other channels like sodium and calcium channels. So in epileptic patients, this system overwork itself. And so because it overwork itself, patient will develop seizures. The second system is this the inhibition system or fighter. The inhibition system also has these receptors that consist of uh, the potassium and the chloride channel. Now, what happened in this case is that because it works less, this channel works less, the receptor site, the receptor channel works less, or the signal, patient will have recurrent seizures. Okay, so you see, there's a problem there. One works high, too much, one works less. So there's an imbalance, and it's supposed to be balanced. So what happened in this situation is that the doctor need to study this particular part because this is where and how we decide the treatment that you give to the patient. Because if you look at it, the whole situation, the excitation system is high, while the uh, inhibition system is low. So there's an imbalance. So doctors need to be careful and study patient. And that is why the treatment of epilepsy is tailored individually. There are different types of seizures according to International League of Epilepsy. One, there's a focal seizures. This focal seizure, the seizure starts from one spot of the brain. Okay. In this case, the patient is having seizure but still aware of the surrounding. There's also impaired awareness where patient might be having seizures, but he or she is not aware of what is happening around the surrounding because there's loss of consciousness. Okay. Now, seizures can be seen like, compared to switching on the electrical bulb at home. Depending on the area, there will be excessive seizures, okay, depending on which is which. For instance, if the seizure takes place in the motor cortex, then patient will have excessive movement. For instance, they have jerking of the face, like, or jerking of the hands and the leg. If it happens on the sensory cortex as well, the patient will have abnormal sensory or sensation. They'll have numbness. They also have tingling. If the seizure happens in the memory area, say for instance in the temporal lobe area, where you have the hippocampus as well, patients will start having these deja vu. And you know that this temporal area is responsible for events and facts learning. Patient will be having deja vu, they have jamais vu. They have this feeling of trying to remember things. These feelings will just be coming to them. They'll be remembering past events. Some of the events might not be pleasant events. They'll feel somehow. You see them change. It might be some sort of seizures affecting that area of the brain known as the hippocampus through the temporal lobe. Now, there's also emotional ones where from the amygdala, the emotional part, the amygdala, if there's a seizure in that area of the brain, the amygdala, patient will start having this, they can have this sudden intense fear. sudden intense fear. They can suddenly start crying. They may be laughing uncontrollably. You can see somebody laughing uncontrollably. It might be a sign of seizure. So all these emotional things that happens might be as a result of seizures that happen or that occurred in that area of the brain known as the amygdala that will cause patient to have this kind of a sudden anxiety. Now, if it happens all the way to the back in the hospital area, patient will start seeing flashes of light or bubbles of light, other visual phenomenon. If it happens in the insula, it will cause autonomic symptoms, which uh, controls the autonomic system. So patient will start having drooling, throat constriction, or skin changes. Yes, that can also happen. And this also happens in the temporal lobe. I've seen a patient that have goosebumps on the right and they're having seizures on the left. So, and all these happen in the temporal lobe as well. So, all these seizures can also spread to other part of the brain. Now, when it spread to the other part of the brain, what happens is that patient will start shaking, jerking, and when this happens, it is called focal to bilateral tonic-clonic seizure. That type of seizure is a generalized type of seizure where you see a lot of electrical activities going on in the brain, a lot of neuronal firing, multiple neuronal firing in the brain, and you see the evidence, the symptoms on the entire patient's body. Okay, so sometimes you see the body disconnect. Okay, when you see the body disconnect, you see that patient has absent seizures. They can be staring like this, and you think this person is looking at you. No, the person might be having seizures. So they will be staring, but it's called absent seizure. They're looking at you, but they're not actually looking at you. They're having seizures. They also have this clonic seizure that comes with jerks or myoclonic jerks, multiple myoclonic jerks as well. There's also atonic type of seizure where you have loss of muscle tone in the entire body. And it's more dangerous because patient can have drop attack. You get it. So when they have drop attack, they might end up having multiple injuries like seizures can sometimes be very difficult to classify. This is because after seizures, patients become tired, confused, and agitated. This state is called post-ictal state or post-seizure state, which usually lasts between a few minutes to some hours. It is also associated with memory loss, tiredness, soreness of muscles, and unilateral weakness on one side, depending on where the seizure starts from. This was first named by Dr. Toads, since he was the first person that described this incident. It is called Toad's paralysis or Toad's paralysis, since he was the first to describe this. If you enjoy what you're watching, please click on the subscribe button, turn on your bell notification so that anytime I drop new videos, you'll be notified. Like and share this video. Don't forget to subscribe. See you in my next video. Thank you for watching. Atutale.